Dr. Henry, as we are convincing everyone to take a vaccine, and I know Fraser has set up the kiosk booth today at the Walmart, but we see not really good response comparatively what we are getting the response from the Sikh temple. Yesterday, in few hours, they registered more than 400 people for next clinic. So why we are not increasing those type of clinic where people feel more comfortable to go there, they are not rely on other people to go to get the vaccination. So there is gap. Even the temple authority saying they are willing to help even 3 clinics a week. So why we are not increasing those services if we want to see more vaccination into the community?
You're absolutely right. We need to do all of these things, not one or the other. And I know there's a concerted effort in the city of Surrey, particularly working with Fraser Health to engage with all those different settings for different populations in those communities. And right now, the immunization clinics that we have are set up to be able to very rapidly expand. So it's much more challenging to bring vaccine by itself to different areas. That's why we're right now focusing on people registering and then supporting them to get to one of the mass clinics. But we are also looking at many different ways where we can bring vaccine to people as we have more and more vaccine available. And one of the things that we're waiting for is the Pfizer vaccine still is a very fussy vaccine. It can only stay at room temperature for a very short period of time. But we're learning more about the stability of the vaccine, and the company has provided data to Health Canada that we hope Health Canada is in the process of reviewing that will allow us to keep it thawed in the fridge for up to a month, and that will make it much more flexible for us to be able to do exactly what you're saying, not only register people but bring vaccine to temples, to gurdwaras, to other community places where people are more comfortable.
Prabjot, do you have a follow-up?
Yes, please. So do you think in coming days we can see more data, how many people got vaccinated in particular communities, especially like in Surrey? What is the ratio of the population above 18 got vaccination, and how many people are not showing interest, something like that, the details?
Yes, and these are the data that we've posted already. We're working on, and I was hoping to have ready last week, but an interactive platform on our website where you can look at that by community health service area and LHA in most places, but CHSA in some areas, where you can actually look not only at the COVID rates, the immunization rates, but also looking at it by age and age group, because one of the big factors that we know is that the structure of the population is different in different communities. So, for example, in White Rock, there's a much higher proportion of older people. So the immunization rates are higher in that community because older people have been able to receive their vaccines for a longer period of time. We know in some communities the age is much lower, so there's a lot of younger people, and that's the case in many communities in and around Surrey, that the population that's eligible for vaccine is now going down. So we should start to see those increasing quite dramatically. And I think the really important thing is what you say, to watch the data move over time. So where we've seen really good results in some of the communities where we've paid attention to it, and I know some of them are actually in Surrey, for example, where we've seen immunization rates go up really dramatically in the last few weeks as we've been paying more attention to it, as we've had the data really only since the middle of April. So that's really exciting, and it's a way for every community to look at how they're doing compared to the population in their community, and it's a way for us to look at each other and support each other to go and get immunized and to keep our community safe, to know that we can each do our bit in our community to keep it safe. The one other thing I will say about the data is And that in smaller communities, there's a lot of fluctuation. We saw that in places like Summerland, for example, where case rates went up really high, but that's just a small number of people because it's a relatively small community. And when people started paying attention to that, of course, it settled back down again. So there's lots of things in the data that qualify what it actually tells us, but I think these are really great things. And going forward, we will be able to look by community and see how we're doing and know that it makes a difference for each of us to get immunized in our community. Did you want to say something about Surrey in particular?
Just to express my appreciation to many gurdwaras, many mosques, other organizations in Surrey who are supporting the effort there. As you know, by local health area, Surrey is more vaccinated than average, but when you look at different neighborhoods in Surrey, the level of immunization varies. But there has been an enormous effort, and that effort is going to continue to grow. I remind everybody in Surrey, because almost all of Surrey is in a community health service area that's considered a hotspot, that it's 18 and above. You register, and you'll be invited to book very soon after you register. People can go as families. All the adults and families can go. It's critically important that to register, though, because whether you're in Surrey or not, after the weekend, everyone's going to be able to register and book their vaccination. And in most of Surrey, in all the hotspots community in Surrey, you can register and then you're eligible to book right away. So this is the time to register. And I want to thank the huge effort in Surrey across political lines, across community lines, and many diverse communities that people are making to get people immunized. So you can see the progress already, and we have to really keep going. This week, in BC, the week that started Monday, where we've booked, I believe, in the neighborhood of 330,000 appointments across British Columbia, and obviously many of those are focused in our hotspot areas. That shows the capacity, and that's going to be a typical week from now on as we build and immunize more and more people. So it's really important right now. It's a real opportunity to get registered today, get registered tomorrow, get registered as soon as possible, and encourage anyone you know to get registered.